So it's my pleasure today to talk about the Dermasweep microdermabrasion technique. In terms of disclosures, I have no financial interest in this company or the product, but we have been loaned some equipment for various studies. Microdermabrasion is typically a spa-type activity for treating patients with superficial sun damage. It doesn't do a whole lot for patients with wrinkles and more severe sun damage. But the critical thing I want to point out here with the Dermasweep is that instead of using crystals, there's a patented bristle technique. You can see here the red bristles are actually moderately coarse, and then the gray bristles are much finer, just for sanding the skin. And of course this is associated with a specific suction where it sucks the skin up into the tip of the delivery system, which delivers not only suction to the skin but also an infusate, which could be hyaluronic acid, it could be alpha hydroxy acid, vitamin C, and so forth. Well, as you can see, the patient that we're going to be treating today has got some superficial lentigos, lots of superficial wrinkles, some actinic keratoses, telangiectasia, which this will do nothing for, by the way. We want to show you the technique with this interesting device. As you can see, the skin is held under tension, usually with 2 or 3 fingers, here with the thumb and the first finger, and then very gently the skin is sucked up into this instrument, which is also quite abrasive. Here we're treating the right cheek, particularly we're treating over the right malar region, which has lots of telangiectasias. As I say, this device will do nothing for the telangiectasias. We'll treat those with a KTP laser or something like that a little later on. But it will help with all the lentigines, the precancers, particularly if you're going to treat them subsequently with a topical agent such as retin A, alpha hydroxy acids, and so forth. You can see we're treating the lower lip and chin region again, nice and tight, scrubbing there again with this red, moderately coarse bristle. So the critical thing to learn here is exactly how to treat the skin. Now I want to show you the technique demonstrated here is perfect. A very light touch. The skin is being drawn up into the end of the device, and it is the efficacy of this technique really depends not only on the coarseness of the brushes, but also how long you perform this procedure, how many times you perform it, whether you use it with different infusates such as alpha hydroxy acids or salicylic acid or vitamin C preparation or whatever, and what other skin regimes the patient might be on. So we're demonstrating how to assess the suction on this device. Your thumb on the end of the device, then you take it off. We're going to look at the machine to see how much suction you're inducing. Look at this technique here, very nice gentle touch, nice gently bringing the skin surface into the end of the device. So this is a device that can be used very nicely by your nursing staff or your estheticians in a medi-spa type of environment, or even in a medical office. And I think the patients really like it, quite frankly. We often add it as an add-on to other procedures. Patients definitely feel pampered. They like the smoothie silk feel at the end of one of these procedures. As always, when these patients come into the clinic, whether it's a medi-spa or a regular clinic, it's important to offer them a general skin exam, make sure they haven't got anything more serious, because although we're pampering them at this stage, we want to make sure that we take the opportunity to exclude anything more serious. You can see we're working right up to the eyelid here, on the eyelid, right up to the lash line. Patients don't have to wear any shields or anything like that, but you do have to be careful. You can see we're working right into the hairline. So here we are at the end of the procedure, a little bit of redness, a little swelling. We're applying some warm, damp terry towels. Just a nice ending to what has been a rather pleasant experience for the patient.
Jaja